Hi, everyone, and welcome to The Balancing Act. I'm Olga Villaverde.
And I'm Montel Williams.
Chronic pain, it can be debilitating, but we have new advancements, and they're helping those who need it the most.
And, you know, an apple a day. Oh, God, you're eating the prop, girlfriend.
I am. It's so good.
Look, you eat an apple a day. You know what they say. Keeps the you-know-what away.
I'm rocking it. Get it?
Yep, I got it.
Plus, improving your credit. And one more time, stand by.
And the Balancing Act begins right now.
Best apple ever.
Best. For the estimated 100 million people living with chronic pain, the quest for effective treatments is often paved with higher risk of, say, depression, suicide, and even substance use.
Spinal cord stimulation has been a cornerstone of advanced chronic pain management for over 50 years. Recent advancements in sophisticated technology and software are now offering patients the reliable relief they've been seeking.
That's so great. Look, let's meet April, who's been coping with her chronic pain for over 10 years.
I've had a long journey with chronic pain. It all started with lower back pain, and I had eventually found out I had a kidney infection, and once we got that taken care of, pain didn't go away. I mean, I was on 12, 15 different medications and still in excruciating pain. I'm a mother of 3, and at the time, they were all in elementary school. There were a lot of times where, in a lot of ways, I almost felt like I kind of ended up neglecting the kids because it was so hard to get up and do things. It made it hard on my marriage. He worked, so I didn't have to, and so he was hardly ever home. I felt very alone for a long time, and it was just a struggle with the day-to-day life. I was extremely depressed. I had changed doctors, and then that's when I started getting injections, and that helped for a while. At first, it would last like 6 months or so, and then over time, I was having to have them every 3 months. With the injections not working as long, they were kind of at the point where there's nothing more I can do for you. I just finally got to a point where it's like, something has to change. I need my life back.
Chronic pain is a debilitating pain that has been present for longer than 3 to 6 months, well beyond what you would typically expect for an injury or surgery type of post-op pain. It can be debilitating in a number of ways, whether that's your everyday activities or your sleep or maybe your mood, but it is impacting your life in a significant way. So the goals of chronic pain treatment are just to get patients back to living their lives. So that begins with pain relief, that extends to improving function and not lose any more time or energy on their chronic pain.
I was seeing my primary care doctor, and I remember getting really frustrated because nothing was working. I just wasn't getting the relief that I needed. And so she referred me to a specialist, and that's how I ended up with the referral for Center for Pain Management. So I met with Dr. Rutledge, and after more testing, finding out that I had a couple slip discs and my SI joint never really fully formed. So when my back would tense up, it was kind of pinching those nerves and sending a really sharp shooting pain down my right leg. It was really great to finally get that validation that, okay, there really is something going on. Like, it's not just in my head.
So a lot of the patients that come see me, they've usually, or at least felt like they've exhausted a lot of their options. You know, we will use our diagnostic skills to figure out the source of the problem so that we can intervene. I mean, that's what we do. So typically we're talking about advanced treatment options when patients have failed the conservative treatments. Some examples of the advanced treatment options for chronic pain would include things like traditional pain pumps, but also the more modern or new minimally invasive spinal decompression procedures we do, our peripheral nerve stimulators leading all the way up to our spinal cord stimulator treatments.
Dr. Rutledge and I came together and decided to discuss further options. Dr. Rutledge suggested that we try the spinal cord stimulator.
So spinal cord stimulation is a great option for patients. What it offers patients is an option outside of medicines, outside of things that maybe don't last as long or things that haven't worked in the past. So typically we'd offer spinal cord stimulation when a patient has a certain diagnosis. These diagnoses can include failed back syndrome after a spine surgery, CRPS or complex regional pain syndrome after an injury or a surgery to an extremity. There are other neuropathies or radiculopathies that we can also use the spinal cord stimulators to treat. It involves an implantable device that treats pain centrally at the level of the spinal cord. It actually includes 2 leads that send stimulation to the dorsal column of the spinal cord. That's that area that carries all of our pain signals up to our brain.
I was still kind of like apprehensive, but then when Dr. Rutledge mentioned that I could do the trial, that made me a lot more comfortable with agreeing to actually try it.
One of the most attractive options of spinal cord stimulation is that you do get a trial period with the device. So a trial period can be anywhere from 3 to 10 days. Typically, we aim for the 7-day mark to give the patient enough or adequate time to test out the device in different scenarios. So from years of data and research, we know spinal cord stimulation works. There are a lot of options out there for patients. For April, we did decide to use the Prospera from Biotronic. This therapy is a newer therapy with the highest technology that we've seen. With the resonance stimulation that we see with Prospera, we're actually able to get broader or even bilateral coverage with single leads that we weren't able to get before. So that means a broader therapeutic range for our patients. We now have data that actually shows that the Prospera device and the resonance stimulation that it provides to patients will help 8 out of 10 of them achieve their pain relief goals and their functional goals. The other reason I chose the Prospera device from Biotronic is that they have a dedicated patient support team called the Embrace One team.
Biotronic Neuro's Embrace One Care team is made up of trained, dedicated specialists who monitor patients' therapy 7 days a week to ensure that it is working its best. The therapy can be fine-tuned for the best relief via a remote programming session anytime, anywhere.
So the Embrace One Care team has been tremendous for my patients and honestly for myself. It gives me the confidence that the device is doing what it's supposed to be doing, that the patients are using it appropriately, that they are meeting their functional and pain relief goals and not falling out of that therapeutic window. So the Embrace One Care team also gives my patients the confidence that their device is working the way it's supposed to be working and that they have a resource that they can reach out to if things are not going how they want them to go.
Today, I'm almost a year out from having the Prospera put in. It's been truly amazing to go from hardly being able to move and just excruciating, debilitating pain to where I am now. I'm now at a point where I can get out and go hiking, I can go kayaking, I can do all of the things that I couldn't do before. I'm off all my medications. I'm doing great. This was the best decision I've ever made. I have my life back.
For more information on the Prospera Spinal Cord Stimulation System, visit embracelifeagain.com. And as always, you can go to our website, thebalancingact.com. Please stay tuned for important safety information. United States federal law restricts this medical device to sale by or on the order of a licensed healthcare practitioner. The Prospera Spinal Cord Stimulation System is indicated as an aid in the management of chronic, intractable pain in the trunk and/or limbs. Implantation of a spinal cord stimulator may be contraindicated in patients who are unable to operate the system or who have failed to receive effective pain relief during the trial stimulation or who are poor candidates for surgery. The safety and effectiveness of this device has not been established in pediatric patients or pregnant or nursing patients. Certain procedures may cause electromagnetic interference, adverse interactions, insufficient or excessive stimulation, damage to the system, and/or therapy failure. Potential risks associated with the spinal cord stimulation system implant and use include pain at the implant site, infection, epidural hemorrhage, lead or stimulator migration, uncomfortable stimulation, and ineffective pain management. Refer to the product instructions for use for a comprehensive list of warnings, precautions, and potential adverse events. Embrace One is a support platform intended to help manage a patient's experience with spinal cord stimulation. It is not intended to be used for medical diagnosis or treatment and should not replace conversations with your doctor about medical questions or concerns. For more information, visit EmbraceLifeAgain.com. Come in small packages, and today you're going to meet the Rockit apple, which we hope, right?
Right.
We really hope is about to become your new favorite grab and go snack.
That's right. And you know, as a mom of 2 little ones, I love a snack that's going to be tasty, convenient, and that's going to be healthy. Olga, for me, that's a win-win.
It's a huge win-win to find that. And we are here in the kitchen, and as Brittany mentioned, all moms and dads, and well, everyone, right? Everyone needs a good go-to snack that's full of flavor.
That's exactly right. I mean, if it doesn't have flavor, my kids are not going to eat it.
Forget it. They're not even going to look at it.
Right. And you know what's so great about these apples? That the Rockit apples are grown to be naturally small, they're fully mature, and they're full of flavor like we mentioned. And the best part about it is that nice, crisp crunch. And with back to school right around the corner, Olga, this is the perfect time for everybody to learn more about these. And honestly, you can try them out for yourself.
Well, let me tell you, as someone that loves to eat.
Cheers. Taste test. You got to let me know what you think.
Good, oh my gosh.
Like very tasty.
This is really delicious. Not only delicious, there's no doubt, and I know this for a fact, apples are a great source of fiber.
That's right.
Vitamin C, and they're the perfect go-to when it comes to fruit for the whole family. Woo, this is good.
It's good, right? And I told you that these are going to be full of flavor, they're going to be full of energy, and the best part about it too, it's giving you those nutrients and those vitamins that you were just talking about. You need those things. This makes it a good for you snack, but these are just so great on the go. Aren't they so cute? They're small enough to put into a little lunchbox. You can even fit these into the kids' backpack. Again, we were saying back to school, can't think of a snack, this is it. Great part about it too is it comes in this convenient tub. So this makes it easy to bring anywhere with you. And what I really like about these two, the size of them. They're miniature, so they're kid-friendly. I can promise you guys, I've got a little picky kid sometimes. They're not always the easiest to feed, but they are gonna enjoy this right down to the core. Mine are still so little. They're both under 4 years old, so for me, this is the perfect size for them. I could totally get them to eat this.
I gotta tell you, it's really satisfying. If one would say, oh, it's too small, no, it's actually perfect.
It's like the perfect bite, doesn't make you too full.
Speaking of perfect, I think this is important to note because a lot of people are very much into the planet.
That's
I am
right.
too. She just showed you the tub over there. I have one right here. It's eco-friendly, so we're always thinking about our planet, and that's important. So this whole thing, eco-friendly, fantastic. My girls are also grown. They're already 20 and 22, but they're still into diets. They're still into looking great. Honestly, I love them too. And not only are they a great snack for long days, but are you ready? I did this little platter. Look how beautiful.
Gorgeous.
I put some cheese, some salami, grapes. I added the apples. I cut them up here. Oh, a little tidbit. Listen up, please. You sprinkle a little bit of lemon, and then the brownish doesn't happen.
Look how genius this is. You can cut out the core. You can decide what you want to put inside. This is really cool with a savory piece of salami. My kids absolutely love cheese. I would put some cheese in for some protein. Talk about a fun and delicious snack for kids. This would be it.
And that's really satisfying.
This is something my kids would 100% eat, but this is something I would eat, especially when I'm on the go. I travel a lot. I mean, this is absolutely wonderful. And I gotta tell you, a lot of the times when I'm thinking about like a snack for my kids, I'm like, what am I gonna grab really quick? Always gonna be safe for chips, but you don't wanna grab snacks like that. You wanna think of something that's gonna be nutritious, so this is gonna be it. And honestly, you know, a lot of those apples that come in like the small bags, they're not mature yet. These are fully matured, so these are just so good for you no matter what.
All right, now we're gonna go from good to great. You wanna hear this too?
Love that.
So Rockit, they have actually partnered with the Special Olympics, and I don't know if my viewers can see that down here, but they partnered with the Special Olympics, and that's near and dear to my heart, and that encourages consumers like you to take the pledge of inclusion. They have a QR code right there. fantastic, on this package so you can learn more. So you know what? You eat something fabulous and you do something fabulous.
It's a win-win. An apple a day keeps the doctor away.
So I've heard.
So make sure you guys check these out. You can find Rockit at all of your favorite stores. We're talking Walmart, Albertsons, Safeway, Kroger, Publix, Target, Sprouts Farmers Market, and so many other ones.
No excuses. All right, so there's no excuse for you not to try it. Go ahead.
I was just going to say, here's my time now. I don't want to have a mouthful of food, but here we go.
I've already finished one.
Cheers.
Isn't it great? Juicy.
Perfect crunch.
It's fantastic. For more information, you go to us.rocketapple.com. They're on Facebook, Instagram. You can also head to our website. We're just pigging out here, thebalancingact.com. These are the best.
No better way. Oh, we've been on set. We're hungry.
Oh, good. Our current economy is affecting some harder than others. Many of us feel the impact every day when we're buying groceries, paying bills, or simply trying to get ahead. We know we need to maintain a good credit score, but when we're struggling to make ends meet, you know, that's easier said than done. So the good news, today we have help from a leader at PREMIER Bankcard. Here with some great tips to help us manage this daily struggle is Suhey Sayer. Welcome.
Hi, thank you for having me.
Thanks for being here, because this is really an important topic. You know, we mentioned the fact that people find themselves sometimes with more bills than their budget. So let's talk about that first.
Yeah, it's actually more common than you would think. A lot of people have to make difficult decisions every single day about balancing their financial obligations with the reality of not having a lot of funds. It can be kind of a difficult process to get out of it, but the number one thing is to be in communication with your lenders.
Great tips there. More common than ever. Don't feel bad about it. Balancing it all might mean tough decisions and no quick solutions. So for someone out there, for all those people out there saying, you know, we owe a lot of money, not a great strategy to go radio silent.
That is correct.
Talk about that a little bit for me.
Yes, so they actually want you to be reaching out to them. They're able to provide solutions that will help you to manage your payment plans. For instance, at PREMIER, we have an award-winning 100% US-based customer service team that can help you find solutions just like that.
That's fantastic. So to sum that up, most important, communicate with your lenders. That is the key. Communicate. Some lenders may be willing to work with you and seek solutions to help manage payments. Now, we know that unfortunately life can be a vicious cycle if you can't make ends meet. What would you say to someone that says, okay, I need to get out of this, but I don't want it to affect my score. I just don't want it to get worse.
Yeah, so I actually have 3 tips for you today that I want to share. The first one is to pay down your existing debt first. Try to get that as low as you can. The second one is to keep your balances manageable compared to your spending limits. And the third one is to stick to a budget to avoid overspending.
And I'm going to sum it up because you said it perfect. Pay down existing debt first, keep balances manageable, live within your means.
Yes.
How many times do we hear that, right?
All the time.
And at PREMIER, what I love the most is that you deal with customers with low credit scores every single day, right, Suhey?
Yes, we do. I've worked there for almost 10 years, and I can say they're just built different than anybody else I've ever seen. Over the years, we've helped millions of customers take that second chance when other credit card companies passed on them. So whether you want to build your credit for the first time or rebuild it, PREMIER wants to help.
So if you want that second chance, it's right here. PREMIER has helped millions. Customer first focus. I love that. PREMIER approves lower credit scores. For our viewers who'd like more information, where can they go?
They can go to mypremiercreditcard.com or check out any of our social media pages.
I think you're going to be helping a lot of people. Thank you so much.
Thank you.
And if you'd like more information, go to our website, thebalancingact.com.
Thanks so much for joining us today.
Remember to head to our Facebook page, like us on Instagram, follow us on X, and visit thebalancingact.com to enter our latest sweepstake or giveaway.
That's right, because you know, you might just win something.
That's right, and if you don't win anything, just buy those apples and you're a winner.
They're the best, I'm telling you. Be safe, love that family of yours, and we'll see you next time.
They're yummy, aren't they?
Really good.
Nice and sweet. Crunchy, too.